Good Monday afternoon, everybody. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is dedicated to businesses in our community who've been following the guidelines and making their establishment as safe as possible for their patrons and employees. We know it hasn't been easy, but we are thankful for the way in which they are using innovative practices to do business while also making safety a priority. As a reminder, because it is a holiday weekend, we are shifting our testing schedule a bit this week. And we'll be offering testing at the main health department location here from 8 a.m. to 2 p.m. Monday through Thursday. That's located at 140 Dameron Avenue. Due to the high volume of people wanting to be tested, wait times could be long, up to an hour or even more. We apologize for that inconvenience, but we also ask that you be patient as our testing team works as quickly and as thoroughly as they can. Also, because of the high volume, results can take up to 5 to 7 days to come back. As a reminder, testing is just a snapshot in time. A negative test doesn't mean you're immune to the virus. It's important to know that testing is also not protection. It doesn't keep you from getting sick. It's just information about whether you have the virus right now or not whether you're going to have the virus in a couple of days or not. Your protection from the virus comes from the community following the 5 core actions. Now I want to take a few minutes to correct something we said in Friday's media briefing. An individual who is positive for COVID-19 should not report to work, regardless of whether or not they are showing symptoms and regardless of whether or not they work in critical infrastructure. Individuals who work in critical infrastructure roles, such as food service, who are a close contact to a positive case, but are asymptomatic, may report to work. So again, close contact, no symptoms, they may report to work. However, they must wear a mask and adhere to specific practices prior to and during their work shift. Additionally, these individuals are asked to only go to work and otherwise stay home. They are monitored as all other quarantined persons are. If they become symptomatic, they become a probable case and are then required to stay home. We apologize for the confusion and hope that provides some clarity. Before we go to the local situation, I want to briefly touch on the Tennessee Department of Health's statement yesterday regarding an unplanned shutdown of the state surveillance system that we also use, called NBS. Because of this, a limited number of COVID-19 test results were imported into NBS over the past day or so. This may have contributed to the lower case count we saw yesterday, with an influx coming today. We will continue to update our data, but please know that until the system returns to full functionality, the data may not be complete. Now we'll move into our local situation. We have 912 confirmed cases of COVID-19 in Knox County. Additionally, we have 29 probable cases. 642 of our cases have recovered, giving us an active case count of 265. 75 individuals have been hospitalized at some point in their illness. Currently, 15 Knox County residents are currently hospitalized. We again today are very thankful to be able to report no more COVID-19 related deaths in Knox County. Over the weekend and into today, our new cases increased over 100, and we continue to stretch the active case count higher. That being said, this weekend is a holiday weekend, and we know it is a popular time to travel or hang out in large groups. We want to remind you to please practice physical distancing and wear a mask if you can't maintain at least 6 feet of distance. While we know people are sick of hearing us talk about these actions, they continue to be the best way to protect yourself and those around you. And those rules apply whether you're at the beach or here in Knoxville or at a cookout or wherever you are. What we like to call the rules of the virus don't change. So social distancing and face mask coverings are very important. As a reminder, we will update the benchmarks this Wednesday to align with Wednesday night's Board of Health meeting. I'll now open it up for questions.
All right, any questions, please go ahead and put them into the group chat, and please type your name in and the media outlet that you're affiliated with. From Megan with WVLT, I believe. After continued increases in COVID-19 cases, is the Knox County Health Department considering mandating mask usage locally following Memphis and Nashville's move to do so?
We certainly got a lot of received many questions about mandating face masks, and I'm sure that'll be a topic that gets discussed at our Board of Health meeting on Wednesday, and that would be a decision to be made by the Board of Health.
From Cole with WBIR, we noticed long lines of people waiting for COVID tests this morning. Have you seen an increased volume of people wanting to get tested, and roughly how many more?
The roughly how many more, we can get back to you with that data, but yes, we've definitely seen an increase. I think we tested over 300 people on Friday alone, so that was our highest day of testing. And so we've seen a lot more people getting tested. One of the reasons for that is we have more cases, there are more contacts, and those contacts are coming to get tested, which is what we want them to do. We've also heard anecdotally that some places that had been testing are not testing at this time. We're not sure if it's because of supply limitations, but so many factors contribute to that. But yes, we have seen more people, and we're actually staffing up to be able to accommodate that, and made some changes in our process to make it go a little faster, even though people still sometimes have to wait.
A follow-up question from Cole was, we noticed the change in testing hours this week. Is that because of higher volume of people wanting tests, or just the holiday weekend?
So it's a great question. My staff is constantly looking at how to improve the process and make sure we're serving the public as much as we can. So they came up with a plan on making sure that we offer as many hours or as much time, total time of testing availability this week. Actually, I think they've increased it by 2 hours overall. So we've actually increased our testing time. They want to squeeze it into this short week, so that's why they made the change. So acknowledging that we need a little more time to accommodate the community need.
Another follow-up question in the same vein from Cole. Do you anticipate having to cut off the line again today as you did Thursday?
We'll have to continue to do that. That's something to expect. So when we cut off the line and we stop testing, that's not the end of our team members' work. They have to finish putting in data and reconciling labs, and there's a lot of work to do after that. So in order to let them get that done and get things packaged and ready to send to the lab on time so that they can get there as quickly as possible, that's why we have those cutoff times. We apologize. We know that's inconvenient if you've stood in line and you're past the cutoff, but it really gets down to the logistics of getting things done and getting the specimens to the lab in a timely manner.
From Claire with WUOT, to clarify your return to work correction, did the policy change since Friday, or did you and Charity misreport the health department's policy last week?
Well, it's actually a CDC and Tennessee Department of Health policy. And I believe we just misspoke last week. I don't recall what Charity said. I know what I said on Friday. So again, if you are positive for COVID-19, it doesn't matter if you have symptoms or not, you're in isolation and you need to be at home and you don't go to work, whether you're essential or not. If you're a contact to a case and you're an essential worker and you don't have symptoms, you may go to work, but there's some restrictions on how you can do that.
From Megan with WVLT, should residents consider avoiding attending cookouts and other celebrations over the holiday weekend? If they do choose to attend, what actions can be taken to minimize the risk of spreading COVID-19?
So residents should be thoughtful about whether they attend cookouts this weekend. I think, last week the CDC put out some more information about who's at highest risk for complications for COVID-19. And really anybody who has a chronic medical condition, regardless of age, you have increased risk of complications from COVID-19. Those folks need to assess their own personal risk and say, is it a good idea for me to go to a cookout or not? If you do choose to go to a cookout, you need to be able to maintain social distancing. So make sure that you keep the size down of the party going. So keep that number down so that you reduce risk. Take a face mask with you or cloth face covering so you can wear it if you need to. Outside is better than inside. I don't know what the weather's going to be, but outside it's also easier just to social distance outside. So if you choose to go to a cookout, you need to follow all the guidelines that exist, the 5 core actions. I've also heard people suggesting that, have your guests bring their own food and kind of have separate picnics just to avoid sharing germs that way.
From Vincent with the Sentinel, from a look at the active testing sites in Knox County, it appears that there aren't any active testing sites in rural areas of the county, places like High School, Mascot, and Coreyton. Is there a plan in place to correct this?
Well, the active testing sites that you're looking at are actually for-profit businesses and nonprofit doctors' offices and things like that that are doing testing. And so they decide to locate their business or their office in the location they decide based on their business model and market stuff and the things they use to make those decisions. So we don't have any influence over that. What I can say is that what we have done and what we'll continue to do is look at where are the places in Knox County where we're not seeing testing happening and try to have testing events in those locations. If you recall, I think we went out to the Carter Senior Center. I think that was last week or 2 weeks ago. And then we went to some other places. So we'll continue to do that. Unfortunately, those are just kind of pop-ups. Ideally, we'd like to have something where we can have ongoing testing in those areas where folks may not have access. And we continue to look at how we might be able to accommodate that using partnerships to leverage staffing, honestly, to get out there and do that on a regular basis.
From Cole with WBIR, Dr. B spoke against a mask mandate at the last Board of Health meeting. Has your position changed?
I think it's a discussion for the Board of Health to have and make a decision about what direction they think our community should go.
From Alex with News Talk 98.7, Knox County has not had a COVID death since late April, while places like Memphis, Chattanooga, and Nashville all have. Do you know why that may be?
It's a really, really great question. We won't know the answer to that question until later on when we are able to really go back and look at the data and look at all of those pieces that contribute to whether people pass away from complications of COVID-19. Until we can dig into that later, we won't know the answer to that question.
From Cole with WBIR, you spoke about the issue with the reporting system, meaning the snapshot of illness in Knox County may not be accurate. How does this impact your evaluation of the local situation? Is the error likely to over or under report the positive case count?
Right. So one of the current concerns is that it would underreport because data is not getting put into the system or not coming out of the system properly. Details about that system and about what happened really are appropriate for the state. It's a system that's actually not even, it's a state system and then a nationwide system that's used. So, we know the numbers we have are solid. I mean, we know for sure the positives we have are positives. There could be positives out there that we don't know about. The other piece of that is as we look at our data, we're looking at the rolling average. We're not just looking at one day. So that's important for us to keep in mind. And even with the possibility of underreporting, we still had several new cases over the weekend.
From Cole, also with WBIR, some areas are using their emergency alert system to send COVID updates directly to cell phones. Is that something Knox County has discussed? And could the health department do that through the EOC?
That's a great question that I don't know the answer to. I guess I'm wondering what kind of information, I haven't seen those. So I'm wondering what information they're sending out as far as COVID alerts. That I'm curious to look at that and learn more about it. Also
with Cole with WBIR, with increasing cases, are your contact tracing efforts keeping up? Do you have any metrics to share?
I don't have any metrics to share today. We have increased the number of people who are doing contact tracing. And I don't, honestly, even off the top of my head, don't have the number of people that we've increased that by. Those folks are actively in our group of people that are doing contact tracing. The other thing that's happened is that we have shifted active case monitoring and other things to the state. So they're doing some of the monitoring for us. There's daily phone calls to see how people are doing, see if they've gotten sick, make sure they're staying home. Those are actually being done by the state now, which takes some of the phone call load off of our staff here to free them up to do the contact tracing. So as far as I know, we've been able to keep up, but I actually don't have any metrics to share today.
From Cole with WBIR, we understand KCHD met with the city about the possibility of reopening some city event venues last week. What was discussed, and are there any updates?
I'm not aware of a meeting, so I'm sorry, can't answer that question.
Any other questions? Please go ahead and type them into the group chat. with Cole with WBIR, TDH reports the West Hills Health and Rehab Clinic in Knox County has had 2 staff members test positive. Any updates?
As you know, we don't speak specifically about any cases.
From Alan Sims inside of Knoxville, what is the percentage of people contacted who are cooperative with answering questions? Are some people refusing to give information?
We certainly have had some people who are resistant to answering our questions. And honestly, it's a lot of questions. We do ask a lot of questions for a good reason, because we need that information to help protect them and their families and protect our community. Most people by far are cooperative and happy to help. They want to be part of reducing risk. They want to be part of reducing COVID-19 cases. So the majority of people are helpful and cooperative and, quite frankly, give us information that we need.
Nicole with WBIR, we're working to confirm reports that travelers from Tennessee will soon be subject to a quarantine when they arrive in the state of New York. Do you think the situation in our state warrants this?
I don't have an opinion on that. I think that's a decision that the state of New York has to make based on what they see coming from the state of Tennessee and other states.
Any other questions? Please go ahead and type them into the group chat feature. All right, I'm not seeing any other questions come in, so thank you all for joining us, and we will see you all on Wednesday. As a reminder, on Wednesday, we will go over the benchmarks this week as opposed to Friday. Thank you all. We'll see you then.